Welcome, everyone, to the webcast that is sponsored by the SJSU iSchool Leadership and Management Program Advisory Committee. This is a committee that is dedicated to enhancing the curriculum for those students who wish to follow into a leadership and management track. And every year we have a webcast on a different leadership topic. And this year we decided to focus on some of the winners who were awarded the I Love My Librarian Award by ALA. I am Sue Allman. I am the chair of the Leadership and Management Program Advisory Committee, a lecturer in the school where I teach, among other courses, leadership and management, and I coordinate the PhD program. But I am here today and delighted to talk to you about I Love My Librarian Award, which, if you don't know about it, is on the screen, a national award that recognizes outstanding public service contributions of librarians working in all different types of libraries and information centers. And our award winners today were selected from among more than 1,300 nominations for 2025. And they are of the 10 that were awarded this esteemed prize. We have three who have said that who have agreed to present today. Charlotte Chung, who is a school librarian, is not able to be with us today, but her presentation will be added to this when she is able to record. But today we have Jamar Rahming and Missy Creed with us. Jamar is just an incredible leader and has some of the people who nominated him said that he has just revitalized the Wilmington Public Library. One of the many programs that really I was taken with is to open a diaper bank. Such a needy endeavor for the users. And he's brought in a number of world-renowned speakers to just have something for everyone at the public library. And he's also going to be one of the keynote speakers in an upcoming mini conference, Library 2.0, on the innovative library. So he's got lots of irons in the fire, so to speak, with lots going on. I can't wait to hear what's happening at Wilmington. And Missy Creed seems to be here, there, and everywhere. It says that she was participated in more than 60 outreach events last year. And she is at the Ohio State Library, an academic library, health sciences, where she works to get reliable health information into the hands of community members. So such a worthy and worthwhile endeavor. Both of these, well, all three, are very deserving of this award. So this morning, we are going to begin with Jamar, bringing the world to Wilmington. So I'll turn off my audio and video right now so that you can hear Jamar, and I'll advance the slides as he wishes. So take it away, Jamar.
Well, greetings, everybody. I serve as the director of the award-winning institution, the Wilmington Institute Free Library. And when I took the helm of this institution in 2018, it was an invisible, undervalued, traditional library. I mean, we had drug deals coming out of our library. We even had a prostitution ring, but because I'm a transformative leader and I'm a visionary, I was able to equip, inspire, and empower my team to transform this institution into an award-winning institution. We were the 2022 winner of the National Medal of the Museum. We were IMLS award winners in 2022. We were the 2024 winner of Library Journal Marketer of the Year. We've been acknowledged by the John Cotton Dana for the American Library Association. And so I just, highlight our awards just to kind of explicate the transformation that we made. The thing that what's incumbent upon public library leadership is that you must meet a community need. There must be something that you're doing in your community that nobody else in your area is doing. There must be branding. There must be novelty. I mean, you must be meeting a community need. And so what we did is that we canvassed our community and we discovered that there were a high volume of our constituents who had never even left the city limits of Wilmington. So we decided that our mission would be that our mission was to bring the world to Wilmington, Delaware, and offer cosmopolitan and transformative life experiences for a working class, predominantly African American community. Also, there was a moment when I was in my office and I, peeked out my office window and there was a 5-year-old boy who had wire cutters in his hand. And I said, well, how in the hell did this kid get wire cutters and what is he going to do with them? And the kid, cut a lock off of a bike and stole it. And within moments he was apprehended, by the police. And so that just shook me to see a baby in a cop car in front of my library. And it also, I also had an epiphany that, here it is that this happened on our front porch. And it just, showed me that we were disconnected, from our community. And so that just kind of gave birth to my vision for the library of offering resources and transforming the lives of young Black boys. And so one thing that we learned, in our community was that that majority of our Black boys were not reading by grade level, and Black boys who do not read by grade level are 10 times more vulnerable to enter the penal system or end up on welfare. So we found out by doing asset mapping, by finding out what was in our community, that there were more barbershops than banks and grocery stores. So we set up 40 pop-up libraries and barbershops throughout the city of Wilmington, and we offered early literacy training to our barbers. And we just decided that we wanted to leverage off of the cultural influence of the barbers, of the local barbers in the African American community. Also, we wanted to associate, we wanted to add some swagger to literacy. We wanted literacy to be associated with the pride and the coolness and the freshness of a haircut. And so we captured data. We had student ambassadors that sustained the project. The books were curated by young children, and so of course the protagonists had no decorum. They were either flatulating or belching or are doing something that they shouldn't have been doing. Also, what we also did, leadership, public library leadership is all about. It's not about what you can do by yourself, but it's about how you can build coalitions. Coalition building should hover at the epicenter of any type of leadership trajectory in the public arena. And so I coalesced all of our stakeholders who had anything to do with literacy, and we had a reading summit. And what came out of that was there was a couple of state senators that got legislation passed in the state of Delaware, House Bill 150, which makes it by law, kids have to be tested for learning disabilities in kindergarten and in the second grade in Delaware, because a high volume of our kids, especially kids in vulnerable communities, underrepresented communities, have dyslexia and certain undiagnosed learning disabilities, which prohibits them from learning how to read. So that was a major win. We started also bringing in New York Times bestselling authors and featuring books that showcased Black men and Black boys to better serve young Black boys and to increase to be a part of this movement of derailing functional illiteracy in this community. So back to what I also said about us canvassing the community and bringing the world to Wilmington. We've hosted some of the most prolific Black and brown voices in the U.S. I mean, we've reunited the cast of A Different World, which had not been done since the Oprah Winfrey Show. We've had LeVar Burton here. We've had Dolly Parton. We've had some controversial people, Dennis Rodman, Angela Davis. So we've made it our mission to bring the world to our city, and our efforts has revitalized our downtown. We have people that travel from all over the United States to attend our events. And so what happens is that they book hotel rooms, they patronize the restaurants downtown. And so our efforts have enhanced the economic vitality of our city. And so also in public library leadership, your leadership must also align with city economic initiatives. You must be able to demonstrate to your public officials and power that be that there's a heavy return of investment of funding, brick and mortar, buildings in your city. Also, we have had some very robust community engagement efforts. I mean, we have toy drives. We house nonprofits, organizations in our building. We have Harper's Heart, which is a diaper dispensary. It provides free diapers and baby formula, to needy families. And so what we've done with that is that we've leveraged off of the social capital of that, because there are people that come to the library to get diapers who have never set foot in a public library before in their entire lives. And so when they come in, we use the dispenser as clickbait, and we get them in, and we market our early literacy initiatives and all the other wonderful services that the library offers. And so we have increased our usership by virtue of this partnership and leveraging off of the social capital of this nonprofit organization. And so I also believe that it's incumbent upon public libraries, in this day and age, especially with what's happening at the federal level with funding being cut for nonprofit organizations, for us to broker what nonprofits are doing, brokering their services and standing in the gap for these nonprofit organizations that are going to lose resources. It'll be a benefit to them and a benefit to us, because we have the space, but we need their social capital. We need the foot traffic. We need the usership. I mean, that's the best marketing that you can do in your library, is to have a nonprofit in there that's life-giving, that's providing vital resources to the community. Also, economic vitality. You must, as a public library leader, do something in your community that enhances the economic vitality of your constituents, because it's all about the almighty dollar. We're competing for taxpayer, funds, and so what we've done, we developed strategic partnerships with banks, with the United Way and the Delaware Black Chamber of Commerce, and we have an annual pitch and ditch competition where people in the community can come in and pitch their entrepreneurial idea, and we will fund it up to $30,000. The event has grown immensely in years, and it has just nurtured the entrepreneurial fervor and spirit in this working class community. Yes, and so one thing about public library leadership, it is all about social impact. And the work that we've done has just yielded great social impact. Some of the images below, when we hosted we've hosted Misty Copeland, and we connected her with a local Black dance troupe, and it just did wonders for them to be in the same room as a trailblazer in the ballerina community. Man, if you ever want to see ladies melt in your library, if you ever want to see women melt and lose their minds, bring award-winning actor Lorenz Tate or Omari Hardwick. I never thought I would see women go crazy in a library, but that's what that yielded. Back to social impact. I mean, we hosted Anna Navarro, and one of our constituents gifted her a piece of jewelry that that her business designed, and Anna shared that. She shared that jewelry with Whoopi Goldberg, and Whoopi Goldberg promoted it on The View and on Instagram, and consequently, this local library, customer, her online business sales shot up 350%. Uh, um, and also, when we hosted the cast of A Different World, there was a young lady who gave one of the cast members a jumpsuit she designed, and one of the cast members modeled it on Instagram. And this young lady was asked to go to. She was asked by a fashion designer to go to Los Angeles and do fashion design work. And so this happened by attending, a library program. Also, at our Different World event, there was a young lady that had wept profusely and just shared how that show had inspired her to matriculate and attend college in light of just some challenges that she was having in her personal life. And unbeknownst to her, one of the cast members had a foundation and awarded her a scholarship, which funded the first year of her studies at Howard University. So again, the work that we have done, it's all about social impact, enhancing economic vitality, having a vision that will equip and empower your teams to engage the community in a prolific and robust manner. So I thank you for listening to my presentation.
Thank you so much, Jamar. I said I wasn't going to do questions until the end, but so many things have come to mind with what you said about the fantastic programs. I got chills when you talked about that little boy with the wire cutters. Mm-hmm. And so many things. I'll just ask a couple questions, if you don't mind.
Yeah.
To get all these fabulous people in, LeVar Burton and Dolly Parton, do you pay for them, or do they come just out of the goodness of their hearts?
Well, you know what, leadership is it's by all means necessary. As a leader, you have to know how to broker deals. And so we have a library foundation that fundraises for us, so that that helps us if we some of these people, we do pay a full honorarium for them to come. Also, what we also do is that many of these people, have written books. So what we do is we negotiate with the publisher, and we do a mass book buy of their books, and we get on their book tour, and that makes it even easier. It's a win-win for both of us because their book is being promoted. We're taking their celebrity name and we're using it as clickbait to get adults to read a book. And also we're getting a celebrity here, and we're not paying because we end up reselling the books and getting our money back. Also, some of these people are very, they're altruistic. They want to give back to the community, and so some of these people, we've been able to reach out and say, hey, would you come, and visit, our community. This is a working class Black community that just would benefit from your voice and presence. And many times they will. They won't come for free, but they'll reduce their honorarium fee. And we're very flexible. And so we also do is that we're between New York City and Washington, D.C. So if we know that there's somebody that we want and they're going to be in New York City, it's very easy to say, hey, would you be willing to stop at Wilmington for an hour? We would be happy to provide the car service and bring you in. So, book buys, our foundation. And then also, by virtue of just our branding, I mean, since we have a brand now, and some of these people are now knocking on our doors and asking to come and have a platform in our space, since we've branded this mission so well.
That's fabulous. So it seems coming out that it's creativity and it's outreach, marketing. One question before we move on, but what about staff training? How long have you been in the library? And it sounds like, it was completely revitalized. What do you do for staff?
Well, I think with staff, you have to, one thing about library leadership is that leadership is all about extracting the greatness out of others to enhance, your library mission. And so, one thing that I'm really good at and adept at as a leader is identifying the strengths and weaknesses of my teams and positioning them accordingly. And when people are exercising their gifts and their strengths, I mean, that does nothing but encourage them, inspire them, empower them. And so, so that's what I did. I have people that are really good at hospitality. So, those are the staff members that are positioned to, to set up the green room and to meet and greet the guests and make sure that, the customers that are coming to the events are comfortable. And I've got people that are really good at marketing and community engagement. So those are the ones where when the visitors come, we make sure that they follow us on social media, that they're engaging our social media pages. And so I have a leadership style that just believes in allowing people to be the best versions of themselves as possible so that the citizens are served well. And also, I think most public libraries, I mean, the kind of work that we're doing, I mean, it would take 3 months just to get a decision made because of so much bureaucracy. And so I've learned how to make bureaucracy work to where we're serving the needs of the community, and we're not just working to sustain bureaucracy.
So definitely internal and external communication skills to get
absolutely. And you cannot be enslaved to your strategic plan. You have to be able to use your strategic plan as a guide to make informed decisions, and you have to operate and many times holistically and organically, because we've had people that have popped up and said, "Hey, I'm going to be in this area on Sunday morning," and we're closed on Sunday morning, our main library. And so we pivot and we open up the library on Sunday and we host them, and we get, 500 people in a line that goes 3 or 4 blocks just because we're flexible and we operate organically and holistically at times.
That's incredible. Just such a remarkable example of what can be done in a library system. So thank you so much for that.
The pleasure is all mine. Thank you for having me.
Yeah, and I hope you'll stay around till the end.
Yes.
Missy, we've got Missy Creed next. Remember, this is an academic library. You don't often consider the outreach that can happen in an academic situation. And Missy has risen above others to do outreach to not only the Ohio State community, but to the areas around. So I will turn it over to you, Missy. We don't have your video, though, right now.
Sue, thank you for having me. I'm going to keep my video off. I am experiencing some stability issues. So
okay,
if you don't mind.
So just let me know when you want me to advance.
Sure. Great. Thank you for having me, and thank you to the committee for having me. And thank you, Jamar, for such a enlightening and uplifting presentation. So this is a photo of my revised Library for Health Information. I thought I'd give a little bit of background about what the LHI, or the Library for Health Information, does. First and foremost, like Sue said, we are an academic library. I'm from the Ohio State University in Columbus, Ohio, and the Health Sciences Library is one of many libraries on their main campus. The Library for Health, though, actually sits inside a hospital and is funded by hospital money. And what the Library for Health Information does is we provide free, reliable, easy to read, easy to understand health information. And I'm going to read that again just because it's so important. And I do it at every presentation I give. It provides free, don't have to return anything, reliable, meaning up to date, and you can trust where the information came from, easy to read. So many people do not have the literacy skills when it comes to health information, and easy to understand health information. So that's what we do. All information is confidential. So if you ask the Library for Health Information a health question, it is between you and me. It is not between anyone else, and your information is kept confidential. We do have some resources in different languages, which is important to note, as Columbus is a diverse community. The materials that are in the library are from the Ohio State University Wexner Medical Center and the James Patient Education Department. And for those that are not familiar with that, is hospitals have patient, or our hospitals have patient education departments. And that is a team of individuals that work to make patient education materials available to patients inside and outside the hospital. And these patient education departments, I cannot speak highly enough of them. They are a wonderful group of clinicians, doctors, nurses, putting together easy to read, easy to understand information on just about any health condition, from healthy eating tips for eating more fruits and vegetables, to a drawing of a brain where to show maybe where an operation is going to take place, to information on how many doctor's visits and screenings a woman or a man should have in their life. I also gather information from the National Institutes of Health and the National Institutes of Aging. They provide free, easy to read, easy to understand, wonderful information on healthy aging, how to take your medication correctly, your tips for preventing falls, for healthy eating as you age. It goes on and on. And my library does pay for some materials, and I go out and I go through the material and make sure that they meet the criteria of easy to read and easy to understand. So to contact the Library for Health Information, there is the email address, health-info@osu.edu, and a phone number where I will take questions either in person if you come into the library, email, or a phone number, and I will mail out, if you leave me your complete mailing address, including your zip code, and ask your question, I will mail out a packet of information that is completely free to you. So let's talk a little bit about the nomination for the award. As they said at the beginning, there was 10 people that were awarded this honor this year. And I am so proud to be with the other people that won the award. It is amazing what is being done out there in libraries. I wanted to talk a little bit about my outreach work. It started in 2019 when the Health Sciences Library joined forces with the All of Us program through the NNLM, the National Network of Libraries of Medicine. And then my outreach increased in 2021 during the pandemic. There was a need for health information to be given out to the public when they were receiving vaccinations. So it all started back in 2019, but it kind of ramped up when I answered an advertisement in the Ohio State University's one of their online communications. Somebody sent out something saying that they were having a health fair, and it didn't go to me particularly. It just went out. It was a mass email, and I answered that email. And from that email, I made my first connections. From there, I was invited to different events, to health events, to health fairs, to school events, to just any community. Somebody was having a festival. Somebody was having where they would give away free clothes or free food. I would go and I would be there and I would set up a resource table sharing the information from the Library for Health Information. So I went from parking lots where I was freezing to major, well-funded and well-promoted events in large venues. People will put on health fairs. They will put on back-to-school fairs. And I always managed to invite myself or to be invited. So another thing that I did for my outreach work is I urged administration to fund giveaways. Along with my resource table, I would have a pen that had the Health Sciences Library's name on it, or the Library for Health Information, or I would have Band-Aids, or I'd have hand sanitizer or something to give away. People would come up, want to look at the giveaway. I would start talking with them about health and health questions that they may have. And I would always remind them that I am a librarian. I am not a nurse or a doctor, but the information that I provided was for them to better get to know their health conditions. So from there, I also, when I was talking with the administration, I always also asked, and I ask every year when it's budget time, for monies to purchase outside materials. And so far, I have always been given some funds to purchase outside materials that maybe that I don't currently have. I've also been very fortunate to be part of the partner outreach program, and that is through the National Network of Libraries of Medicine. And Ohio is in Region 6, and I have had some great dealings with the POP program and some great information sharing events to put on outreach. So when I talk about, when I think about leadership in the LHI, I think about having a vision. And when I started outreach, I wanted to get out into the community and reach as many people as I possibly could each year. The other thing that I've learned is collaborate, collaborate, collaborate. And I cannot emphasize that enough. Also, you have to problem solve. You also have to invest in yourself and engage with the community. All those points are very, very important. So digging a little deeper into vision. When I look at my vision, I look at what kind of librarian do I want to be? What kind of library do I want to represent? And fortunately, I am in a great place where I get to interact with people from all over Central Ohio, but also through my library all over the world. I also look at what my values are, and my values are to reach out and to help people make informed health decisions. Another thing about vision is planning. And planning, little steps will get you there. I never envisioned back in 2018, when I started my current position, that I would be sitting here talking to you about leadership and the Library for Health Information. But I'm so happy that I am here. So looking at collaborate, like I said at the initial slide there, collaborate, collaborate, collaborate. Start now. I don't care if you've been in a library for 20 years. It's never too late. Never too late to reach out to the other side, to reach out to the community, to reach out to other librarians, to reach out to other staff, anybody that wants to collaborate with you. And I also don't take no for an answer. No might mean that they just can't do it at that current time. That's one bit of advice that somebody gave me in a leadership course that I took, was don't take no for an answer. Just because they can't do it now doesn't mean that in 6 months they can't work with you. So always try to circle back and see if that no can turn into a maybe, that can turn into a yes. The other thing that I've learned in collaborating with people is you have to show up and you have to be consistent. Be a man or woman. Be somebody that can be consistent. Your word means everything. The other thing that I also learned in collaboration is you always give first and ask for something in return later. So you always show up, you always represent your library, and then maybe the next time you might ask to be invited to an event that may not be right up your alley, but you're interested in it. So always give what you can first and ask for something later. Problem solving. I never thought I was much at problem solving. I am a library of one, and I have learned to problem solve. And I've heard this before, look at them as opportunities. And it is so true to look at them as opportunities. Problem solve. Try to problem solve by yourself. but more than likely it is going to take a community, like Jamar was saying, reach out to people and see if those opportunities can be turned into something wonderful for your library and for your constituents. And this is something that I've believed in all through my career, is investing in you. So take full advantage of any professional development, grants, awards, any free training. Look outside yourself look for training outside your interest. For example, you may not want to look into something that has to do with fiscal parts of libraries, but look into some training that training may come in handy further on down the line. Always look for something free. Apply for grants. You've got nothing to lose. You spend a little time filling out the grant application and putting yourself out there, and you might get professional development dollars to attend a conference, to attend a course, to be able to go somewhere that you may not have thought possible. Always engage with your community. I sit inside of a hospital, but I have learned to engage with not only Central Ohio, but all over the country. People know that the Library for Health Information exists, and they contact us. I try to listen to the community when I go to different health events to see what they need and what they want. For example, Uplift Her is a health fair that is fairly common in Ohio, and I know it is spread throughout different states. But when I talk to the people about coming to their fair, I always ask, what do you want? What do you need? How many people are going to be coming? What are their expectations? And Uplift Her is all about women's health. And so the majority of the information that I bring is all about women's needs. I do bring some health information for men that may accompany them, but the majority of the information is about women and some health issues that we may face. Show up. I can't say that enough. You show up, you do what you say you were going to do. So if you said you were going to be early, or you said they wanted you there at 9:30, you be there at 9:30, ready to engage, ready to lend a helping hand in whatever you can do. Oh, that takes us to questions and answers.
Thank you so much, Missy. Both you and Jamar have been so inspirational. What I wanted to ask specifically, though, Missy, is when you first got the MLIS degree, were you interested in health sciences, or can you tell us a little bit about the path that you took to get there?
Sure. When I obtained my MLIS, I was switching careers and came into librarianship. I love the fact that libraries can help people be the best versions of themselves. So if you need to learn how to do a presentation, go to the library. If you need to learn how to do job skills or fix your car, go to the library. If you need health information, go to the library. So when I first obtained my degree, I went into a public library, loved it there, but wanted to get into an academic library. And from there, I went to Columbus State Community College. And from there, I really learned to engage with the community that was coming in. Some people were new learners. Some people didn't speak English. Some people were coming right out of high school. Some people were coming back after years and years of being at a job, and they needed to come back and retool themselves to go on. So, and from there, I went to the Ohio State University and Health Sciences Library, and I worked in circulation. And I learned a lot about dealing with students and what they need and how to handle a reference question. And from there, I decided that I wanted to apply to get out and do more work in the community. And when the position for the Library for Health Information opened up, I scrambled to get my application in and to make sure that I was a leading candidate.
Thank you so much. So that I want the students who are going to be listening to this webcast to know that there are different ways to move through the profession, and that leadership comes, as you say, from lifelong learning. Both you and Jamar have indicated the things that you're learning along the way. I do have a couple questions, and you might even have questions to ask one another. But what other projects are you involved in or that you want to initiate? Can we start with you, Jamar?
Well, I really liked what Missy said about, giving first before you ask. And that has really given us a high return of investment here in Delaware with library work. We've just, we've taken, Missy's, I don't know what you call it, but we do what Missy has done in terms of giving before we ask. And we, as a result of us just being open and serving our politicians very well, a couple of them got together and pushed for state funds, and we're building a brand new library in one of our most, barren, desolate communities in the city of Wilmington. And it is called a community hub, and it's one of the first in the nation that's 100% designed by the community. We got 100 people from all different parts of the community, and they are the ones that are meeting with the architects and the designers. And so this library is community designed. So that's what I'm presently working on.
That's incredible.
Mm-hmm.
Do you sleep, Jamar?
No, not really. Yeah.
Missy, how about you? Projects that you're involved in or want to initiate?
I do not think that Jamar does sleep. I met him when we were accepting the award, and I believe he's on 24 hours a day. Let's look at some other projects that I might be involved in, or something that I may want to do in the future. I want to continue with outreach. The need is there more than ever.
Yeah.
And the need is there for people to understand what their doctor is saying and to have those informed discussions when you're at the doctor. I say this all the time when I give presentations. Imagine yourself sitting in front of the doctor and getting a diagnosis or getting test results back that you were not prepared for. Your brain kind of leaves your head. It does, and you just focus on those couple words, or you just zone out. Well, the information that the Library for Health Information can provide is easy to read, easy to understand. So you can go home, research reliable websites, contact the Library for Health Information to find that information out for you to go back and have an informed discussion with your doctor to have informed decisions about what you should do for your health, because your health looks different than mine. So I want to continue with outreach, but I also want to look at health literacy. People may be literate, but they may not be health literate and following directions that their doctors give them. And the other thing that I have seen in Central Ohio, and I'm sure Jamar has seen it in his many contacts, is we're a very diverse country, and we need health materials written in different languages. So, for example, how to stop smoking, how to have a better diet, and we need to honor people's diets and make sure that we're relaying health information that is going to be sensitive to their needs as well. So finding reliable health information in different languages is something else that I would look forward to initiating. We have some, but we just don't have enough.
And it sounds, Missy, like you're on the go all the time as well. Whether you're
Yes.
in your office or out promoting it, both of you are extremely involved. The two questions in the middle, I think you both addressed them on the importance of partnering with other institutions and the best way to network within your community. But do either of you have something additional that you wanted to say about this that you didn't get a chance to?
I think the
Um,
only thing that I could say in the question, what is best, what is the best way to network within your community, is never discount anybody.
wow.
You have to, no matter their position, no matter their title, you don't know how you can help each other. And we're here to help each other.
Absolutely.
And every interaction, no matter how small or big it is, every interaction is an opportunity to develop library advocacy. Um, and the work in this day and age is not to have library users, but to have library advocates. And just back to Missy's presentation, public libraries, we've been so honed in on youth, but Missy is really onto something with health literacy, because in another decade majority of our constituents will be 65 and up, and so the work that Missy's doing is going to be something that I think public libraries across the nation are going to be seeking to um, offer even in public library institutions is health literacy and helping people navigate the medical field effectively.
And there's so many literacies that libraries need to be aware of.
Yeah.
There's reading literacy, health literacy, information literacy, technology literacy. We've got our work cut out for us for sure.
Yes.
Okay, so final question for right now is, do you have advice for current students or recent graduates that are trying to decide what career path to take, or what would be best for them? So your advice, if a current student was sitting in front of you saying, I want to get into leadership and management. Missy, how about you? Because you're a solo librarian, which is, I used to call that meatball librarianship, because you do a little bit of everything,
Yes.
all rolled into one. So what would you have to say, Missy?
I sure do a lot, and it's all rolled into one. My best advice for current or recent graduates is take chances. It's okay to fail. Your failures are going to lead to different opportunities. You may not think it in the moment of failure, but you need to turn that around. The other thing that I would say is, and I said it before in my presentation, no doesn't really mean no when you're asking for something. You need to come back to them and say, okay, you may not be able to fund this or come to speak or attend this health fair or whatever, but can I reach back out to you in 3 months or 6 months? Or can I keep you in my contact list? Or do you know somebody else that would do it? So you just have to keep trying. You have to keep pushing on. And then the other thing is, don't forget about professional development. Jamar is wonderful with his staff. I mean, to be able to zone in on somebody and say, this is your talent, and do you want to embrace it? And then they just get to run with it. But not every place is like that. So you need to find out what your talents or interests are too, because you may not think you're talented in that area, but you have an interest in it. And you just may surprise yourself. I'm sure that you will surprise yourself because, as Jamar said, libraries, we're not going away. We are part of the community. We want to be part of the community. I want to be out there. I know Jamar is out there, and I know the other recipients are out there singing the praises of libraries and all the different people that work in the libraries that make it come to life.
Thank you. Jamar.
As someone that had to lead a library system through the pandemic, I mean, the ground was pulled from underneath us, and as a leader, we did not, as a leader, usually when there's a problem or a crisis, I mean, there's another library director I can call and say, how did you handle this? But this was one time to where we were all pushed in a corner. We did not have a framework or template for this, and so we had to pivot. We had to be creative. We had to fortify our staff and our communities in a time of crisis. And we're kind of watching, we're watching civilization kind of spiral out of control, especially with book banning and colossal threats to intellectual freedom. And so my advice to you is that, if you are seeking positions of leadership, you must be prepared to deal with a lack of normalcy. Normalcy does not exist anymore, and you must be prepared to deal with just about anything nowadays. And so it's not for the weary or the faint in heart. It's for people with thick skin, and thick skin, that's not something that library school can give you. And thick skin must be something that is a part of your own, personal repertoire. So I would say that dismiss any. It's illusory to think that you're going to have a normal trajectory serving in any type of leadership capacity in this era of history.
Thank you so much.
Yeah.
We're out at the end of our hour. We filled it up and we could keep on going with what you're doing, but it's easy to see why the two of you were selected for I Love My Librarian Award. You are truly inspirational, and I thank you so much on behalf of myself and the Leadership and Management Program Advisory Council for taking time to meet with us today. So thank you so much for joining us.
Yeah, the pleasure is all mine. Thank you so much for having me.
Thank you as well.